Did you know that your skin is your largest organ and it has a fascinating ability to heal itself from injuries? That's right. This incredible organ protects us from external harm, regulates our body temperature, and allows us to feel the world around us. And when it gets injured, it kicks into overdrive to repair the damage. When we think about healing, we might imagine a small cut that disappears after a few days, but what about more serious injuries like burns? Skin healing is a complex process that involves multiple stages. Initially, it's all about protection. The body quickly forms a clot to stop any bleeding and a scab to shield the wound from infection. Underneath the scab, the real magic happens. New cells grow, blood vessels reform, and the wound starts to fill in. But not all injuries are created equal. While minor cuts and scrapes generally heal without a trace, deeper wounds can disrupt the skin's structure, leading to scarring, and it's here where burns come into the picture. Burns are a unique kind of injury because they affect not just the surface of the skin but can reach deep into the underlying layers. Depending on the severity of the burn, the skin may not be able to fully regenerate, which leads to scarring. But why do these scars form, and why do they look different from the rest of our skin? Well, it's all down to a protein called collagen. Collagen is the main building block of our skin, giving it strength and elasticity. When a burn occurs, the body produces collagen at a rapid pace to repair the damage. But this quick fix can lead to irregularities in the skin's texture and color, resulting in visible scars. So, while our skin is remarkably resilient, it's not invincible. Serious injuries can leave their mark, reminding us of the body's incredible, yet imperfect healing process. But, have you ever wondered why burns leave permanent marks? Stay tuned as we delve deeper into this intriguing world of skin healing. Burns are not just any ordinary injuries, they have their unique healing process. Burns are classified based on the depth they affect within the skin's layers. The skin is composed of three primary layers: the epidermis, the dermis, and the subcutaneous layer. Each layer plays a crucial role in our body's response to burns. First-degree burns are superficial and only affect the epidermis, the outermost layer of the skin. These burns typically present as redness and pain but heal within days without leaving any scars. Second-degree burns, however, extend deeper, reaching the dermis. These burns often cause tissue erosion and open the door for potential infections. The body's response to this damage is to initiate a rapid collagen production process to heal the affected area. But this accelerated collagen accumulation can lead to irregularities in skin texture, resulting in scars or raised, uneven skin. More severe second-degree burns may form blisters, but these usually heal within weeks. It's crucial, however, not to pop these blisters as it can lead to further complications. Third-degree burns are the most severe and extend down to the fat layer beneath the skin. These burns often leave permanent scars as the fibroblast cells responsible for collagen production are destroyed. Finally, fourth-degree burns penetrate all skin layers, reaching the muscles and bones. These burns are life-threatening and require immediate medical attention. Scars and skin marks are not exclusive to burns. Deep wounds or impacts causing substantial damage to skin layers can also trigger collagen production, leaving lasting marks. Incorrect practices such as peeling scabs or exposing healing wounds to excessive sunlight can exacerbate scarring. So why do burns leave permanent marks? The answer lies in the body's healing process. When the skin is severely damaged, the body produces collagen to repair the affected area. But this collagen is often not as flexible as the original skin, leading to a visible and tangible scar. Let's delve deeper into this fascinating process of scar formation in the next scene. Scars, those unsightly reminders of past injuries, have a story to tell. Woven into these marks are tales of survival, of our body's remarkable resilience and ability to heal. But how exactly do these permanent reminders come to be? Let's delve into the mystery of scars. Our skin, the body's largest organ, is a complex structure that's constantly regenerating. But when it's significantly damaged, as in the case of burns, this regeneration process changes. Our bodies kick into overdrive, rushing to repair the damage as quickly as possible. The main player in this process? A protein called collagen. Collagen is the most abundant protein in our bodies, giving our skin its strength and elasticity. Under normal circumstances, collagen is produced and arranged in a well-organized pattern. But when the skin is wounded, fibroblast cells rev up collagen production to mend the damaged area. The catch? This rapidly produced collagen is often arranged haphazardly, leading to the formation of a scar. The severity of the burn plays a significant role in scar formation. The deeper the burn, the more severe the scarring. First-degree burns, which affect only the top layer of skin, usually heal without scarring. Second-degree burns, however, reach the deeper dermis layer, and the resulting collagen overdrive can lead to raised, uneven skin. Third-degree burns are the most severe, penetrating the subcutaneous layer, often leaving behind extensive, permanent scars. But scars aren't exclusive to burns. Let's explore further. Any injury that reaches the dermis can trigger this accelerated collagen production, leaving a lasting mark. Even everyday habits like picking at a scab or exposing a healing wound to excessive sunlight can disrupt the healing process and exacerbate scarring. So while scars might be seen as blemishes, they're actually testament to our body's incredible healing abilities. They're a sign of the battle that our bodies wage to protect us, a story of survival written in the language of collagen. And understanding these stories can help us better care for our skin and appreciate its remarkable resilience. While burns are notorious for causing scars, they aren't the only culprits. There's a whole gamut of other factors that can lead to scarring too. Deep wounds or injuries, for instance, that reach the dermis or deeper, can also trigger the body's collagen production process. This is the body's way of healing, but it can result in irregular skin texture and lasting scars. But it's not just the severity of the wound that matters. Even seemingly minor mistakes in wound care can have a significant impact. For instance, peeling off scabs prematurely can interrupt the healing process and lead to worse scarring. Similarly, excessive sun exposure on a healing wound can damage the new skin cells and worsen the scar. In essence, scarring is a complex process influenced by multiple factors. It's the body's natural response to injury, but sometimes it can leave a lasting mark. Now that we know how scars are formed, how can we treat burns to minimize scarring? Proper treatment of burns can significantly reduce the risk of permanent scarring. Now let's delve into this a little deeper. The immediate care for burns involves cooling the burn with lukewarm running water for roughly 10 minutes. It's crucial to avoid using ice or very cold water, as this can cause further damage to the tissue. Also, resist the urge to apply butter or toothpaste. These are old wives' tales that can actually introduce bacteria and lead to infection. Instead, after the burn has been rinsed, apply a moisturizer such as aloe vera gel. This natural remedy is soothing and helps retain moisture in the skin, aiding the healing process. It's important to remember that if blisters form, they should be left alone. Popping them can open the door to infection and increase the chance of scarring. Covering the burn with a clean, non-stick bandage or gauze is the next step. This keeps the area clean and protects it from further injury. Remember to keep the wound moist, to prevent the bandage from sticking to it, and also to shield it from direct sunlight, which can darken the scar. While these first aid measures can be taken at home, it's crucial to seek medical attention for severe burns. These burns penetrate deeper layers of skin and require professional care. Medical professionals can provide proper wound management, including debridement, which is the removal of dead or damaged tissue, application of sterile dressings, prescribing antibiotics to prevent infection, and administering pain relief. In many cases, burns can heal within 2 weeks. However, severe burns may take longer, and can even require skin grafts or reconstructive surgery. The role of medical professionals in treating burns is critical, not only for immediate care, but also in managing the healing process to minimize scarring. And there you have it. Understanding burns and their healing process can help us minimize scarring. It's about knowing what to do immediately after a burn and when to seek professional help. If you've found this video informative and helpful, we'd greatly appreciate it if you hit that like button. Your support encourages us to keep producing valuable content. Don't miss out on our upcoming videos. Subscribe and click the bell icon for notifications. Join our community of knowledge seekers. Remember, hit like, subscribe, and keep the curiosity alive. Stay tuned for more intriguing insights.